News First, Newsline.
Crises that Sri Lanka has been facing. The health crisis, of course, is one of the worst because that deals with the lives of all citizens of Sri Lanka, and we've suffered so much at the hands of this health crisis, and the suffering is not yet over. In fact, it's just beginning. What aggravates this health crisis even more is the massive brain drain that's taking place in Sri Lanka. Now, to discuss these matters and much more, we've got with us a General Committee member from the Government Medical Officers Association, or the GMOA, Dr. Thenuwan Wickramasinghe. A very good evening, Doctor, and welcome to the show.
Good evening.
Doctor, first things first, there's a massive brain drain happening in the country. The health sector is in crisis. This is not the first time that we've discussed this topic on this show, specifically addressing the shortage of doctors, because like the saying goes, you know, to solve any issue, you must first identify it. And when it comes to health issues, the identification is done by the doctors, of course. And if we don't have enough doctors to cater to the general population of the country, that puts us in a real fix. So, in a bid to address the brain drain and then the shortage of doctors in the country, the government has gone back to this controversial decision, given the history of this decision and what it has, resulted the country or brought about to the country. The opening of private medical campuses, universities. Now, initially, a little bit of history onto this, Doctor, before we get into the subject. Initially, under the government of Mahinda Rajapaksa, I believe, Saitam, one private medical institution, was given the go-ahead. They did open up, they enrolled students. However, under the government of good governance, there were massive protests, especially by the student community, and I believe GMOA was also a part of these protests against these private medical universities. And the same party that initially supported this decision and approved this decision then got onto the streets along with these protesters and protested against this decision. And the private medical campuses in Sri Lanka were withdrawn. Now we do not have any more of them. Now they have approved another proposal, of course, in Parliament to establish private medical campuses. What is the GMOA's stance on this matter?
First of all, thank you very much for inviting GMI for this valuable discussion. Talking about these private medical universities, if you take the history and if you think about what has happened, as you mentioned earlier, the establishment of private medical university in Sri Lanka cannot be done in days. It needs a long process. It need a feasibility study and what to do, what not to, how we are going to maintain this, what is the teaching hospital we are going to get.
So wasn't any of this done during the establishment of the previous private medical university?
So that is why it got failed.
None of this was done? None
of this was done.
Okay, all right.
It was money-oriented program that they started. So that's why it was failed. There was huge protest throughout the Sri Lanka, and everyone, almost everyone got together. No one was in other field. So that was the scene earlier. So again, this has come to the stage, and what we see now is, as you have mentioned, that there's a huge brain drain at the moment. And we are losing doctors to the other countries. Especially, we are losing consultants as well as the medical officers. So if you think about the medical education of our country, it depends upon the teaching hospitals, the trainers, and the medical colleges. So if we are losing the trainers to the other countries, at the moment we are lack of trainers in our country for our state medical universities. So at such situation, if we are thinking about starting a private medical university, do you think that our government state medical education system, will it sustain? The lot of people who are working there will be prone to go and work in the private medical education sector. So we are already in a shortage. So if this continues to happen, these people will go and start working there, and our entire state health sector, the state medical education system, will collapse ultimately.
But then, Doctor, wouldn't it be better for these state, these teachers, of course, these trainers, as you mentioned, for them to maybe join a private medical campus in Sri Lanka instead of traveling overseas? Wouldn't that be better?
So then what about the medical students who are entering into the state medical universities? They are the one who has gained the maximum out of their education. The taxpayers' money has been utilized best by those people. They have qualified to get into a state medical university, and they have the scope of becoming a skilled doctor in 5 years, 6 years time. So if they don't have the standard medical education from the skilled professionals, from the experienced teachers, so what will happen in 5-6 years time is the doctors that are producing from our state medical universities, the people who cannot afford for a private medical education will be deprived of their education.
But then, doctor, all of these matters are very connected, and it's almost sometimes like a hole in the bucket. We come back to the same issue. The doctors who are graduating from state universities, which is the only accepted practice now because there are no private medical universities in Sri Lanka, the doctors who the Sri Lankan general public has invested so much of money in are the same doctors who are leaving Sri Lanka at this very critical juncture.
So I didn't get your point actually.
So these same doctors that you say are needed in this country, that we need to strengthen the state education system. So these same doctors, no matter how strong the state education system is, they are the same doctors who are leaving this country right now.
Let me clarify this problem, that despite having a 30 years long war in Sri Lanka, we could retain the doctors in our country, not within the country even, we could retain them within the government sector without any problem. So we were providing the same care available in Colombo in the periphery settings also. So that is because the doctors were staying in this country. And what happened was, with the economic crisis and the COVID pandemic, we had a lot of problems having in this health sector. One problem is there was a huge taxation on doctors. Starting from 6% up to 36%, doctors were taxed. On top of that, the cost of living went up hugely. If you think about only the transport, petrol went about, when it is double now. It was 170, now 361. So the total cost of living went up. And the working environment for the doctors is not conducive as earlier. If you think about the drug shortage, quality failure, and whatever it comes to the working situation in the country, so doctors are not in a favorable position. So all these factors contributes for them to leave the country. So that is they are the main reasons why people are leaving the country, and they are working in UK or European countries or maybe in Middle East.
But also, doctor, given the crisis that Sri Lanka is in now, there is of course the issue of practicality. Of course, it's great if doctors can be given more incentives, if doctors can be given more facilities. It's amazing. But however, the situation that we find ourselves in now, by the intentional doing of certain individuals or just by simple mistake, requires a certain level of flexibility. I mean, the GMOA has, of course, advocated for the rights of doctors, for the remuneration of doctors, and so on and so forth. But what really is the practical solution here, doctor?
Actually, GMOA is not only complained about this problem. We have given a very comprehensive set of proposals to the government. These are practical proposals. We are not telling that we must given the same salary as UK or Australia. We know that it is not practical here. But we have make a proposal to pay a market value. There is a market value for everyone here. The performance based and market value salary for a doctor. We have asked the government to agree to it in a policy wise. And at least 50% of this, if we can give in the first step, that is acceptable. And we have asked to give us a reasonable travel allowance. That is very, if you think about a consultant working in Jaffna Teaching Hospital, whose family lies in Colombo, he has to travel at least once a week to Colombo and Jaffna. If you can imagine how is the transport cost for him. Because we have been not given any facility by the government. Our vehicle, driver is the same person, our fuel, maintenance, everything is managed by the same person. So we have given a 8-fold proposal to the government, giving solution for these problems. All of them are not even monetary ones. There are things that the government can do in overnight. If you think about the schooling problem of a doctor, where the consultant is maybe working in Anuradhapura, the family lies in Colombo.
Right.
So he can't take his family to Anuradhapura or vice versa because there is no proper schooling for his children. And think about a consultant who is coming after foreign training from a European country, maybe from United Kingdom. Once he landed here, if his kid is not getting a proper school, will he stay here? So this government does not have to bear any cost for this one. They just need to take a policy decision.
But Doctor, all those issues that you mentioned, of course, the transport cost, the traveling cost, everything is very true, of course. And these are issues that must be solved not only for the medical profession, but for the general public in total.
Yeah.
But the issue here really is that for the doctors that come out here in Sri Lanka, like you said, they come out through the state mechanism, they work very hard, and at the end of the day, it's the taxpayers' money that really fund them. One might wonder as to if maybe doctors should take a step back and, you know, try and cope with the system that is here now. I'm just speaking from the perspective of a third party. Because everybody in Sri Lanka is suffering. And I do understand that people have their own freedom. If they want to migrate, they can migrate. But at the end of the day, we are facing a serious crisis as a country. We're not only facing a financial crisis, we're facing a governance crisis. We are facing a situation where people in power are still lying to us. They are still trying to suppress us. So wouldn't it be better for maybe doctors or other professions as well to band together and maybe try to change the situation instead of demanding for financial remunerations?
Let me clarify you one thing. If we are talking about the taxpayers' money, the professionals are the people who have utilized the taxpayers' money up to maximum level. Because taxpayers' money has been given to everyone, but that has been utilized best by the professionals.
Who has it been worst utilized by, Doctor?
You have to decide on that. You know that you told that some people are lying still. So on the other hand, you told that whether we can cope up and come back and step back and so if you think about this tax fight, so GMOA initiated and GMOA established a forum, Professional Trade Union Alliance, that comprised about 40 trade unions, and we have been fighting for this tax issue since January. Before this is implemented, actually last year. So what the government told was that we are in a commitment with the IMF and our first review will be on September. And once that review goes on, we may be able to give a concession for you.
Okay.
We can come with amendments.
Okay.
So as a responsible trade union and a responsible alliance, we gave that space to the government. So from January up to September, for 9 months, we paid taxes, starting from 6 to 36%. So now the IMF delegation is here. So the government gave us assurance that they will be reviewing and amending our taxes. So it is the government's responsibility now, because the professional has been staying here for 9 months, paying these taxes. So we have actually coped up. We have actually kept our promises. So it is now government's time to give the assurance to us.
Doctor, also you spoke about doctors traveling overseas for better opportunities, so on and so forth. Now, one of the main issues that you mentioned here in Sri Lanka for professionals and doctors in general to stay back in Sri Lanka is the tax structure. But in the United Kingdom or many of these countries that these professionals are traveling to, the taxes are much, much higher. The cost of living is much, much higher. For example, just to put this into context, maybe a person who is earning 1 million Sri Lankan rupees in the United Kingdom couldn't live a luxurious life as a person who is earning maybe 100,000 here in Sri Lanka. We need to put that into context. So what do you have to say about that?
Yeah, that is the reason why people are migrating to European countries or Middle East is not only the money that I have to mention. So although the tax rates are high in, say, United Kingdom, it's around 40% taxation. So although they have been taxed 40%, people are gaining things because their quality of life is much better. If you go to their transport system, so it is much, much easier and smoother than in Sri Lanka. So even if you go to if you think about the working environment in United Kingdom, so it is really conducive. And if you think about the career pathway that is available for a profession in UK, that is very favorable for them. And if you think about, if you told about the money that they earn and the amount they pay. So if you compare these things, even though the huge disparity between the amount that they get here and there and the cost of the quality of life that they are having there, trend them to go there and work. That is why we are losing these people to those countries. And even if I will give you a small example, the skilled consultant here are paid 88,000 of basic salary.
Okay.
When it comes to the total take-home salary, it will be around 250,000. The same consultant, if you go and work in Europe, they will earn 3 million easily. So, do you think that is there any reason for them to stay here rather than when there are a lot of opportunities?
Doctor, I'm asking you this question just before we cross over to a short commercial break, just because I don't know the specifics here. In Sri Lanka, government doctors are allowed to run their own private practices. Is it the same in the United Kingdom with the NHS?
Yes. So, even though you think about the private practice, the people who are doing private practice are wasting their leisure, wasting their time that could be spent with their family, and wasting they are just doing it because they can't survive without that.
Exactly.
So,
I understand.
if you think about the general doctors who are working, the general medical officers, there are only 30% who are doing private practice, less than 30%. So, even in UK, if you forget about the private practice, say that you are doing private practice in Sri Lanka, but not doing private practice in UK, still there is a huge disparity.
Dr. Wickramasinghe, we were speaking about the health crisis here in Sri Lanka, and the first half of the program we focused on the brain drain, the reasons for it, and hopefully we'll try to come to a solution, a viable solution at the end of the program. But we're focusing your attention a little bit now on the collapse of the administrative structure of the health sector here in Sri Lanka. Best examples being the people who lost their sight after going to conduct certain surgeries on their eyes. They go to the hospital, of course, to maybe remove a cataract or something. They end up blind. Then there were several instances where people went to hospitals for maybe a small injury, a stomachache, a little bit of a fever, and certain medicine were administered to them, and those medicines were of questionable quality, and now investigations are underway as to if these people lost their lives because of this medicine. We know the collapse in the administrative structure here. The details are just out there. Nobody's doing anything about it, really. It started off really, or one of the biggest incidents that comes to my mind at least, is the NMRA data wipe. Data of suppliers of medicine to Sri Lanka that were on the government cloud at the NMRA were deleted. And it was revealed in court that the data was not mistakenly erased. Someone actually sat down at a table and hit select, delete for a period of about 7 hours. Now, Doctor, as the GMOA, this is a really serious issue because you spoke about the working conditions here in Sri Lanka, the fact that doctors can't prescribe medicine to their patients with the confidence that these patients will be cured by it. Actually, they're in two minds as to if this patient would die after taking this medicine. So, isn't the GMOA really pushing for better administration of the health sector here in Sri Lanka that was once one of the best systems, at least in Southeast Asia?
Yeah, the health indicators of Sri Lanka is one of the identical thing. It is internationally accepted that we have the health indicators as similar as the developed countries.
Okay.
So, if you talk about Australia, they are spending about 6,000 USDs per capita health budget, and United States about 12,000. But we are maintaining the same indicators with 160 USDs. So that is with the proper human resource management that we were having. And the health crisis that we are having at the moment are few folds. One thing is we are having shortage of drugs. Another thing is we are having quality failures.
Okay.
Number 3 is we are having breakdown of investigation procedures, machines and all. The service agreements are not happening. Number 4 is the most serious one, the poor human resource management, the brain drain.
Right.
So, if you think about these all problems, say we were talking about the drugs issue now. So, there are 5 entities in the health ministry who are coordinating this drug issue. The Ministry of Health, Medical Supplies Division, NMRA, SPC and SPMC. So the Auditor General's report that was published in May 2022 clearly states that there is no coordination in between these 5 bodies. So if the SPC doesn't know what are the drugs manufactured in Sri Lanka, they import them from the other countries. So it is like that. So if you think about the holistic approach, the incoordination in between these things, the unavailability of a digitalized system, unavailability of a proper procurement system, failure to keep adequate stocks, these are the main administrative problems we are having.
So, Doctor, these administrative problems, of course, have been identified time and time again, especially through the audit report of the government auditor. So, the issue is, though, nothing is being done, Doctor.
I will give you a small example for this, that what GMO has done. GMO has been predicting this crisis even before it happened for months. And we have been giving proposals, we have been giving media statements, we have been discussing in the different meetings, and we are expressing in different forums. And one thing we told is that there are about 1,400 drugs that is working in 1,100 drugs. There are 14 vital drugs and 646 essential drugs, and there are non-essential drugs about 500. So we recommend the government to scrutinize this and cut down this amount to 800 odd drugs. So we could save maybe 10 billion from the drug budget. But that scrutiny was done. All the colleges were agreed, the proposal was made, but it was not implemented. And again, we proposed to the government that if you think about a diabetic patient or patient with a high blood pressure, there are many drugs that they have been prescribed. So there are common drugs, there are rare drugs. So if you can choose 1 or 2 or 3 common drugs out of this list, and if you can give them to a concession price to the customer, the patient will be able to purchase that one. So that one was not implemented. And the worst thing that happened is, if the public is going to lose the trust on the government health system, it will not be recoverable. So just think that during the COVID time, the people who were going back to the private sector was diverted to the government sector. People had good faith on government sector. They got the vaccine, they followed the instructions, they came to the hospital. So with the things that people are losing their vision after eye surgery, now they are losing the trust on the government health system. So it is actually a catastrophe.
So, Dr. Wickramasinghe, given the situation in the country right now, we are looking at, maybe coming out of this rut that we're in. What is the GMOA's take on the actions that have been taken by the government to address the health crisis?
Thinking about the drug problem, we are thinking that there should be long-term and short-term plans. Thinking about the short-term plans, if you think about the long-term plan first, we don't have a proper quality assurance lab. So we should have a state-of-the-art proper quality assurance lab which has the international accreditation. But it takes years. So as a short-term measure, we have a lot of laboratories in the university system. We have a lot of laboratories in the private sector. But have we ever explored, have we ever think about what we can get, what are the facilities that we can get from them? So these are 2 aspects that we have to think about, the quality of the drugs.
No, but my question to you, Dr. Wickramasinghe, is the GMOA satisfied with how the government is, or the Ministry of Health, call it what you will, the authorities that be, is handling this situation and is addressing it? Are you satisfied with how this situation is being addressed?
Not at all. Not at all. We are not satisfied. That is why we are pressurizing the government daily. If you see the media conference and what is publishing in your media also, daily news and all those, we are giving press releases daily. We are pressurizing them. We are, at the moment, we are planning, we have no option other than going into some trade union measures in the future. Because if this trend of losing doctors to the other country continues, what will happen is the peripheral system will shut down eventually. The central may function for a short period of time, but the peripheries will shut down. And the doctors who are remaining here will get exhausted. And there will be a herd effect on them too. The people who doesn't want to migrate, they will also have a herd effect to migrate. And when the trainers are migrating, as I told earlier, the medical education system will collapse. So in 7 years' time, we don't have doctors here. It takes 7 years to produce a good doctor and 15 years to make a consultant.
So, Dr. Wickramasinghe, in your analysis of the situation, or at least the heed that the government is paying to these warnings, cautionary statements that are being released by the GMOA, do you think that they just don't care about the situation?
Actually, whether it is purposeful or not is something doubtful in everyone's mind, whether they are doing it purposefully or not. So we have been planning a series of action now. Now at the moment, for this week, we are educating our parliamentarians, religious leaders, general public, and everyone we are educating on the crisis. So today also we have sent a letter to all the parliamentarians and party leaders describing this crisis and what are the solutions.
Do you think that they might read it?
That is we have a doubt. We have a serious doubt on that. But it is our professional responsibility to educate them. So if they can have a voice in the parliament, if they can have a voice in the government, if they are thinking that if you do not put the cap on this drain, how much you put from above will not retain there. There are 5,000 odd doctors who have completed the foreign qualifications now. That is 1/4 of the entire doctors community in Sri Lanka. They have completed the qualification examination procedure, they have got the license in other countries, and they can move in at any time. So if they are retaining in this country because of some commitment.
Doctor, one final question on this brain drain issue. Since the general public are investing so much of money in producing a doctor, do you think it's fair for the government to maybe put in a mandatory period that a doctor should serve in Sri Lanka before they can apply for employment overseas or apply for any qualification that would give them accreditation as a doctor in a foreign country?
At the moment also there is a mandatory period that you have to work before.
How long is that, doctor?
After getting passed from the university, after doing the internship, to go to a postgraduate, they have to wait 1 year.
1 year?
Then only we have to start the postgraduation.
Okay.
That is in Sri Lanka. After doing postgraduation, you go for the foreign training. With that, we are going also in a bond. There is a bond that before you have to sign and go.
Right.
So we are going on that bond. So if you think about a problem, there are solutions at different levels. If you take the last solution at first, so things will be not solved. So just think that if you give a proper leave to a doctor to go abroad and come, at least they have a commitment to come back. Otherwise, if you try to restrict them, what will happen is they will just drop the job and go. They will never return.
Thank you very much, Dr. Wickramasinghe. A very fruitful discussion, of course. I'm totally in agreement with you on the point that if we try to bring the measures of last resort first, I mean, they're called last resort for a reason, that the situation will get even worse. But the problem really is, Doctor, that we have, the first level solutions, second level, third, fourth, fifth, last level solutions. However, no solution is being proposed or implemented at this point of time, and that is the issue. And I hope and pray, of course, for the betterment of Sri Lanka as a whole, for the entire general public, that this health crisis, of course, will see an end sometime soon. And the GMOA and the medical community in Sri Lanka will have to definitely play a big, big role to get that done. Thank you very much to all our viewers out there for tuning in. Until we meet again, take care and God bless.